February 22nd, 2021. The planet continues to be held hostage by a global pandemic called COVID-19. Rolling lockdowns, economic uncertainty, and misinformation is rampant.
We're in the middle of the most significant public health emergency of the last 100 years.
The first presumed positive case of COVID-19 was confirmed on January 25th, 2020. A patient at Toronto's Sunnybrook Hospital.
This is the stuff that you're going to see in history books long after we are gone. Yes. This is going to be written about and spoken of for many, many years to come.
To date, confirmed global cases are 111,555,751. Confirmed global deaths are 2,469,729. As of the same date, Canada has 845,652 cases and 21,674 deaths. Each one is a person, a mother, a father, a brother, a sister, a daughter, a son. How did we get here? I'm Roger Mooking, and this is Real Talk. Dr. Eileen de Villa is the Medical Officer of Health for the City of Toronto.
We know that what actually creates health and maintains health are all these things that have nothing to do with health or healthcare in the way we normally think of them. Income, appropriate and supportive housing, education, the environment, the air quality, access to clean water, civic infrastructure, your sense of belonging, right, to your community, a social network that actually supports you when you need it. These are the things that really create and maintain health.
Dr. Suzanne Shoush is the Indigenous Health Faculty Lead for the Department of Family and Community Medicine at the University of Toronto.
It's not only not the first pandemic, it's not the first pandemic that we've had. It's not like it's been 100 years since the last pandemic. We went through SARS in 2003, H1N1 in 2009. We've also had sporadic Ebola epidemics that threatened pandemics.
How is this different, and how is this playing out differently in your minds?
So I would say that the story of this pandemic all the way through has been about making these very difficult choices, right? None of which there were no really good answers. There are difficult trade-offs that need to be made on every single one of these decisions. And these decisions all had to be made with incomplete information.
The strongest and probably the most important social determinant of health is not resource, it's actually privilege. So it's privilege, it's political influence, it's economic influence, it's a world that was built for you and designed for you for centuries and centuries, right? And without privilege, it's the communities that have that privilege that have been able to stay home, that have been able to stay safe, that have been able to have packages delivered and groceries delivered, and people without privilege or with less privilege providing those services for them.
Weston Road, as it's affectionately known, is a community in the Toronto area that has a disproportionate number of high-risk members and amongst the highest rates of families below the poverty line nationally. Stachen Frederick is the executive director of Western Frontline Center and founder of Braids for AIDS.
Help us visualize and understand, what do you see day to day at Western Road?
It's sort of crowded, of course, with these high-rise buildings, right? And so, you have our young people, coming down in elevators that X amount of stories of buildings, right? And people have to go to work because most of these people are essential workers. And so, they are going to have more contact when it comes to people because of their crowded spaces, right? You also have where, moms are not able to just stay at home and, take care of the kids while they have school. And some parents have to then now decide whether or not I go out and make an income or I stay home and take care of my kids, because I can't call a babysitter to come to my house now because we're on social distance, right?
And if you work, you also can't afford to do that every single day.
Absolutely. The first time that you're seeing people who have never come to our center. You hear this thing about it being, a health pandemic, but it's also a social pandemic.
And this is not an issue of people not understanding. People are not getting COVID and their communities are not at positivity rates 5, 6, 7, 10 times other communities because they didn't know the facts or they didn't have the information. It's because exactly what Stachen said, they have to work. Transit, they have to have their children in school, they have to have childcare, they have to provide personal services, personal support work, personal health work for people who are staying home. The idea of an essential worker is no longer just the physician at the hospital. It is also the people that have to do the groceries, that have to do the gas stations, that have to make sure that the world continues to work for the people that have privilege and for their specific needs. And if their specific needs do not include the Black salon, do not include the Black restaurant, and their needs do not include things that our community needs, then we will not see those things prioritized. And one of the most glaring examples of this was when you started to see restrictions lifted. And some of the first restrictions lifted were things like housekeepers, butlers, golf courses. I was like, what's next? Tanning salons? You can very clearly tell that the people at the table are not likely a diverse table because they're selecting these essential openings and essential work based on their very, very, very specific needs of their community.
We've heard about, the impact on children, the impact on mental health, the issues around job loss, and the impact on health that has. How do you choose between these things?
As an Afro-Indigenous woman, I am super focused on prioritizing my mental health during these scary and uncertain times. And like many women and racialized people and immigrants, I was among the first to be let go at my job when COVID first hit. And so it's been challenging at times to rebuild and pick up those pieces, not only on a financial level, but also on a mental and spiritual level as well.
As I get ready to start my shift, I think about how grateful I am to have a job.
COVID has affected me in a huge way this year. I've been working online and helping my students learn and grow in the middle of a pandemic.
Dr. Roberta Timothy is an assistant professor in the teaching stream and is the director of health promotion at Dalai Lama School of Public Health at the University of Toronto and an adjunct professor in critical disability studies at York University.
I noticed in January 2020, when Asian folks from China were dying, it wasn't a priority for our system. I was like, every day I was counting and I was like, oh my gosh, somebody else is passing. And it wasn't an issue until folks in Europe were started to die, and the numbers in Italy, France, Spain increased. And I wrote about that quite early on because it was interesting in terms of whose life was valued. Out of sight, out of mind when it comes to Black and Indigenous and racialized folks is kind of how we operate.
I've been thinking a lot about the impact of COVID on our social cultural practices. What does it mean to organize outside of the mosque in our community centers?
COVID's given me a new perspective and appreciation for family, friends, neighbors, community, and country.
In terms of accessing healthcare, Black folks and Indigenous folks, and the folks that I know, there's people who are not not accessing healthcare because there's a lot of restrictions right now, but there's also distrust of a lot of healthcare practitioners. We don't trust healthcare because we've been treated poorly, so now what's happening is that, okay, there's less services being offered and people are really like, they're not going in.
So Dr. Shoush, why is that exactly? Because I know you work very closely with the Indigenous community as a member of that community, and you work very closely with people who are experiencing homelessness as well as the Black community, right? So why is that skepticism that people have with interfacing with the healthcare community?
Healthcare stereotype threat is significant, and the people most likely to experience healthcare stereotype threat are Black, Indigenous, people experiencing homelessness, people who use drugs, and people who are incarcerated. Having the ability to overcome it by seeing somebody who sees you as an actual human being, is a full human being, and not as a collection of biases and stereotypes and notions about who you are and where you come from, is incredibly important. I think that without an acknowledgement that these systems of racism exist, it's going to be really hard to get anyone to buy into anything. Most Black people are, if they are mistrustful of the vaccine, it is because of the experience of everyday racism, of healthcare racism, of structural systemic racism, economic exclusion, political exclusion, all of the other ways in which the system is clearly not designed for you, has never been designed to benefit you, and it's very easy to think that it's there to harm you. These are people who have been providing essential services and who also have incredible skills to offer. And they are still experiencing homelessness because of policy decisions based on that are driving the housing crisis. People who are working, people who go to the hospital as a PSW by day and live in a hotel with their families by night because they've been put in a hotel because their shelter was having an outbreak. 91% of Indigenous adults in Toronto live below the low-income cutoff. Not only that, 71% have explicitly stated that issues of racism, bias, and discrimination stop, prevented, or delayed seeking care. And then you see these other situations where it actually becomes this double-edged sword, where you're harmed on both sides. You're harmed by the harm and you're harmed by the help. You're also harmed by the system that's created around you to make you not trust the cure, not trust the care, not trust that there's something there that could help you.
It is so important to always take care of yourself. Always put your health first.
I moved to teaching online in September and will be there until June, so that's been a huge change, and I've really missed being in a classroom with students.
And with no plans for the foreseeable future for any social events, COVID has taught me that happiness is having something to look forward to.
My life is that it's given me an appreciation for my health and an opportunity to learn more.
COVID has made it extremely difficult for me to network in this time, and so it's been very frustrating to be trying to grow as a director without being able to make many connections.
We share stories of what have happened to each other. And that's why sometimes people are like, do people really have our best interests at heart? So why are we going down this route with people? And that's the stories that I hear. And that until that we can change the narrative of how our community have been treated within the healthcare system, nothing is going to change.
People do not feel safe. I mean, I wish that, Dr. Shoush could be everybody's doctor, but Dr. Shoush needs to sleep. You understand? She needs to sleep. But we want doctors who represent us and who can understand, our experiences. And so our people are not feeling comfortable because they haven't felt comfortable. The healthcare system does not bring comfort to Black and Indigenous folks.
Although we're in the midst of a global health crisis, the problems exposed go far beyond medical. Holistic problems require holistic troubleshooting, and they're all connected intimately.
The only people I have ever seen die of a vaccine-preventable illness have been Indigenous children. And I will never forget, it is burned into my soul, watching a young child die of bacterial meningitis, which is a vaccine-preventable illness. And it is horrific. It is so unnaturally terrible. And Yet you see this, for a while I became very aggressive about vaccinating. I was very much like, a woman would come in and I would just say, I know we got experimented on. It happened to my family too. We need to do this right now. It doesn't matter. Like, we have to push it. I need to vaccinate this child. This is so important. And then slowly realizing that some of those people wouldn't come back to me. And it would hurt me because I felt like a personal failure that I was from their community and I still didn't succeed in convincing them to do this. And then starting to realize more and more that I'm here to listen to you. I can answer your questions. Pressuring you to make a decision that I feel is in your best interest is not going to improve your health.
So what I'm trying to do, and what the team at Toronto Public Health is trying to do, is find ways to support people. So if you get COVID-19 and those are your circumstances, you're in housing that doesn't allow for the proper or a good isolation to be effected, we're providing isolation centers, and we've advocated for that, and we've got that. We're advocating for paid sick leave so that people can actually, recover, right? Actually get tested.
It's critical.
Right? We need to make it easy for people. Like, that's the whole point of public health. How do we make the healthy choices, the right thing to do, the easy thing for everybody to do, so that they protect their own health and they protect the health of others around them?
Health outcomes are directly related to the social determinants of health, like income, gender, race, and literacy. Policymaking decisions also play a critical role. Good policy requires real action. Vaccines have been developed and manufactured at an unprecedented pace due to even more unprecedented global cooperation. Global vaccine distribution faces a multitude of challenges, but still, by will, they're being put in arms. The challenges are numerous.
And I think that when you're looking at, the power of having the chiefs take the first vaccine on Facebook Live, the power of the elders coming in. We sat with the elders in the communities for hours. We also have to have the logistics of a community engagement of people like myself, who is the daughter and the granddaughter of residential school survivors, going on to then sit with other residential school survivors, holding their hands and listening to their stories before we can build the trust to give the vaccine.
There's an assumption of racism, or the act of racism, and is that one person speaks for the whole community. That's a problem. And government and policy, public health, were not really interested, in that. They were saying that race-based data wasn't important, intersectional data wasn't important. So the pandemic was not focusing, even though it was affecting us disproportionately, the response wasn't focusing on us. And people would say that, anti-Black racism, anti-Indigenous racism is a pandemic. It's been a 400-year pandemic that we've been living through. We have some great policy, but it's not implemented. So number one is to have implementable actions, for policy. The second piece is to who are we bringing to the table regarding creation and implementation of policies.
I'm a person of color experiencing the world, right? And I know, as a person of color, by firsthand experience and by statistically understanding, we just don't trust anything anywhere coming from the government at all.
I think we actually have to find a way, action by action, to demonstrate that we are worthy of that trust.
But Doctor, if I may interject, you're dealing with hundreds of years of this compounding.
Yeah, you're right. You're
Mountain
right.
Challenge.
Totally right. But we'll never solve it if we don't right. That journey of 1,000 miles starts with a single step, right? And then the one after that, and the one after that, right? But recognize that in the short term, the most effective thing may be to reach out to partners in the community who we do have a trusting relationship, and who in turn have trusted relationships with others who rightfully perhaps don't trust government and don't trust healthcare because they've not been treated well by government, by healthcare, or by other formal institutions of our society.
There's no denying that the challenges are mountainous. The journey will require a relentless disposition, They are also complex and will take time. We just don't know how much time.
One thing I do daily is I try to do something positive, an activity that's positive, regardless of how I feel. So if I'm feeling bitter, depressed, angry, whatever it might be, I try to do something that'll help build a habit of positivity as we progress through this pandemic and afterwards.
When COVID first started, it definitely challenged me in a lot of different ways. But I think the biggest thing it allowed me to do was really take a time to pause, reflect, and look inside of myself to ask myself certain questions about who I was, where I was going, and what was really important to me.
There are many people working diligently, and together, they're learning more each day. And our desire to move beyond this difficult time is universal. Together, we are stronger.
How do we get out the other side of this? What hope can you tell the people in your community, Stachen, that will offer them hope to get to that next place, to see we see that there's a light at the end of the tunnel. We don't know how far this tunnel is, and we don't know how bright that light is. But you are clearly working in this field because you want to get closer to that light and you want to shorten that tunnel, right? Yeah. So what is that for you? What does that look like for you?
Such a heavy question. I can tell you what I envision. I envision that our young people experience safety, value, and true well-being.
You said you envision a place where the kids and the community feel loved and supported. Mm-hmm. That is everything, because once you feel loved and supported, you feel empowered and strong. When you feel empowered and strong, you can now envision a moment where you can be empowering and the strength for somebody else. And that is the essence of the whole conundrum that we are in. I say this all the time. Individualism is the scourge of our society. This is Ubuntu. I am we. We have to love ourselves, yes, but we have to love our community. And I'm not just talking my Black community. We have to love ourselves. You have to be surrounded with love to understand that you love yourself, then to love the next person and love the community. This COVID conundrum is not a small bubble. It is a holistic issue that needs a holistic approach, and it impacts people and actual human beings every day. I'm very, very grateful for your academics, but also your compassion and your heart that you bring to what's happening here today and what you do every single day, all three of you. Thank you.